Welcome to this special podcast featuring Dr. Kate Granger. Kate is a final year elderly medicine registrar working in Yorkshire, but she's also a terminally ill cancer patient. In this podcast, Kate talks about how she's used social media to publicise her Hello, My Name Is campaign. This campaign encourages healthcare staff to take a few seconds of their day at every consultation to humanise the experience of being in hospital. So here's Kate Granger talking at the BMA's annual representative meeting.
So, hello, my name is Kate. I'm going to tell you the story of why those 4 words have become really quite important to my life in the last year. I really wasn't a big social media person before I got ill. I occasionally posted the odd photo to Facebook. I'd never got myself on Twitter. So all this is really relatively new to my life. But a little bit about my backstory. This was me. I'm 29 years old, happily married to my husband Chris, a third-year elderly medicine registrar, enjoying a nice holiday on the Californian coastline. 2 days after that photo was taken, I was admitted to hospital in the States with an obstructive uropathy and a creatinine over 600. The reason for my sudden illness? An abdomen and pelvis full of tumours. Bang, out of the blue, aged 29, I'd got cancer. I was patched up in the States with some ureteric stents to save my kidneys, and I came home to pursue more investigations and treatment with the NHS. After multiple painful procedures, including bilateral nephrostomies and several biopsies, it was determined that I had a very rare form of sarcoma called a desmoplastic small round cell tumour. It had spread to my liver and my bones, and I was therefore in a palliative situation. There followed 5 rounds of intensive inpatient palliative chemotherapy. I was very sick, in hospital the majority of the time. On New Year's Eve 2011, I made a big decision, and that decision was to stop my treatment and go back to work. So 3 weeks later, I was back on the stroke unit in Pinderfields, doing what I love to do, which is look after older people. I was unexpectedly well for a period of 18 months, with very little in the way of health problems, until September last year, when I started to feel quite poorly again. Relatively quickly, it was apparent that my cancer had progressed, and I had to make the heart-wrenching decision of whether to undergo chemotherapy again. I did, and again, it was very tough. I had febrile neutropenia every single time, with a neutrophil count of 0.0. I needed multiple transfusions, and I was really very sick. I got through all that, and I'm still alive to tell the tale, and still working. So I've had a lot to do with health services over the past few years. And one of the things that has become apparent to me as a patient doctor is that the little things really do matter. It's the little things that make the difference between a good experience and a bad experience. And when I say little things, I mean people introducing themselves to you so that you feel like a human being. I mean somebody holding your hand when you're upset and receiving horrible news. I mean somebody sitting down next to your bed rather than looming over you and bringing 10 people in on a ward round. I mean that extra moment of silence that gives you that time to express your fears and anxieties properly. Those little things really make a huge difference when you're a patient. In August last year, I had the stents that drain my kidneys replaced. It was a normal operation, uncomplicated, and I went home the same day. Unfortunately, 36 hours later, I was back in hospital with post-operative sepsis and really quite poorly. I was triaged by a nurse in A&E who I'd worked with, and that was a nice experience, and then things started to slide. I was clerked in by a junior doctor who called himself one of the junior doctors. He had no name and no role until I asked him, and seemed a bit put out that I wanted to know this information about him. A clinical support worker or healthcare assistant, I'm not sure which, then cannulated me and took my blood test. She had no name. A nurse then gave me some antibiotics. She had no name. She didn't check my name or my allergy status either. And then I met Brian. And Brian was the porter that was going to take me to the ward. He checked that I was comfortable on the trolley. He got me extra pillows and blankets. He'd noticed that I was in pain. So he took extra care to push me over the bumps in the corridors on the way to the ward, all the time speaking to my husband and me reassuringly. Brian was doing the little things, and he was doing something that made me think, about how we care for patients and one of the most basic steps in communication. There then followed a week-long admission to a urology ward, where this lack of introduction seemed to permeate through everybody from the medical staff, nursing staff, support staff, housekeeping staff. Nobody really had a name and nobody really wanted to know my name. I became known as Bed 7. So, I talked to my husband about all this, and Chris isn't a doctor. He works for a well-known supermarket chain as a logistics manager. He's a very practical person, and he told me quite clearly to stop whinging, darling, and do something. And the result of that conversation was #hellomynameis. We decided to use my already significant influence on social media, particularly Twitter, to launch a campaign to engage and inspire healthcare professionals about the importance of introductions, to make everyone stop and think that did they actually introduce themselves to every patient they met, or was it something that had slipped away from their consciousness. I designed a logo with the help of a graphic designer friend, and my IT geek brother designed us a website. I personally believe that introductions are a bit more than just common courtesy. I think it's more about making a human connection, about building therapeutic relationships, about trust and rapport. And how can you do that if you don't know each other's names? So I wrote a blog about my experiences and invited my blog readers to pledge their support for the campaign by writing their introduction to a patient. So, hello, my name's Dr. Kate Granger. I'm one of the senior doctors on the ward looking after you. How are you feeling today? Or, in essence, whatever anybody wanted to write. This blog was visited by thousands and thousands of people within a few days of me writing it. And soon, my hashtag was being used all over Twitter, with patients and relatives and healthcare professionals all joining in the conversation about the importance of introductions. I was asked to write for the BMJ and interviewed for several high-profile healthcare literature. And all of a sudden, I had a global campaign on my hands. People were writing to me asking for the logo. It was popping up on conference name badges. There were little simple reminders in the clinical workplace, screensavers, lanyards, name badges, selfie campaigns, cupcakes, you name it, it happened. And it's still happening. It's growing apace. Then the government decided that they wanted a piece of the action. If you turn to page 36 of the Department of Health's Hard Truths, you will find a box all about hellomynameis. And then Jeremy Hunt himself thought he wanted a piece of the action too, and mentioned it in a high-profile speech about continuity of care. He didn't actually ask for my permission to do that. So he got a bit of a hard time on Twitter. I took the idea to the International Forum on Quality and Safety in Healthcare in Paris, where I indoctrinated one of my own healthcare heroes, Don Berwick, into the campaign. I had a poster and did a talk at that. I also took the idea to the Expo in Manchester, and I've just come back from closing the NHS Confederation. That all happened to me because I had one tiny idea. I thought it was important that people introduce themselves and started a hashtag. I'm now very busy, hardly find any time to do any clinical work at all because I'm always being asked to go and give talks to different hospitals. I was in Burton last week and I'm launching my own campaign in Leeds in a couple of weeks. So social media can have a massive impact if you use it in the right way. It can really change. You can use it for quality improvement in a really significantly global way. My idea has been used at Johns Hopkins University. It's been used as part of the Australian Change Day. There's all sorts of things happening all around the globe because of my tiny idea, and that's all been facilitated by the power of Twitter. These are some of the statistics from Simpler last week. 32 million Twitter impressions in 10 months. It works out at about 3 tweets an hour. That's about all I wanted to say about social media. It's changed my life, and in a similar way, I've had so many professional opportunities as well as hellomynameis. So I would strongly urge everyone to have a little go and see what they can get out of it. No talk of mine would be complete without a little plug for my book. So I wrote 2 books about my experiences of cancer, my relationships with healthcare professionals, and what it's like to be in my position, living with a terminal diagnosis hanging over me. All the money from those books goes to the Yorkshire Cancer Centre, for which me and my husband have raised over £120,000. Thank you for listening.
I hope you enjoyed this podcast, and if you enjoyed this, look out for our future podcast featuring Ben Goldacre.